Hello everyone. So today we will discuss about strengthening. So strengthening is one of the important components of therapeutic exercises. So we can prescribe therapeutic exercises to the patient to improve the overall function of the individual. So as a physical therapist, what is our primary or main goal? Our primary role is to increase physical function of the individual. Therefore, we should be well equipped with knowledge to prescribe therapeutic exercises, and strengthening is one of the major components of therapeutic exercises. So, to increase the physical function of the individual, we have to improve the muscle performance. If the muscle performance is improved, then ultimately the physical function of the individual will be improved. Similarly, cardiopulmonary endurance, mobility and flexibility of the joints and the muscles, stability, balance, posture, equilibrium, and other neuromuscular control and coordination should be improved to have better function of the individual. So let us concentrate on improving muscle performance. What is muscle performance? Muscle performance refers to the capacity of the muscle to do work. So it is force into distance. Muscle performance has three elements. Those are strength, power, and endurance. So let us discuss what is strength, what is power, and what is endurance. So strength, muscle strength is a broad term that refers to the ability of a contractile tissue to produce tension and a resultant force based on the demands placed on the muscle. So this is muscle strength. Let us understand it by an example. For example, there is a subject A and subject B. Subject A lifts 5 kg weight, whereas subject B can lift 10 kg weight. So who has more strength? Subject B, because subject B can lift 10 kg weight, whereas subject A can lift only 5 kg weight. Next element of muscle performance is power. So muscle power is related to the strength and the speed of movement and is defined as the work produced by the muscle per unit of time. So you need to remember that the power is related with time. So it is force into distance by time, or strength by time. Or it can simply be told as rate of performing work. So with example, let us understand what is power. Again, let's take subject A and subject B. Subject A can lift 5 kg of load in 5 seconds, whereas subject B can lift 5 kg, the same load, in 10 seconds. So who has more power of lifting a load? Subject A, because subject A can lift 5 kg in less time, that is 5 seconds, compared with subject B, who can lift the same load in 10 seconds. Now the third element is endurance. So endurance is a broad term that refers to the ability to perform low intensity, repetitive or sustained activities over a prolonged period of time. So endurance is more focused with number of repetitions rather than the amount of load. So again, let's take an example of subject A and subject B. Subject A can lift 2 kg of load and can repeat for 20 times, whereas subject B can lift same load, that is 2 kg, and can repeat the exercises only for 10 times. So who has more endurance? Subject A, because subject A can repeat the exercise with the same load for 20 times, whereas subject B can repeat the exercises with the same load only for 10 times. Other examples for endurance can be given as a cardiopulmonary endurance, such as walking, cycling, and swimming. Now, strengthening can be enhanced by using the resistance exercises. So, what is resistance exercises? It is any form of active exercise in which dynamic or static muscle contraction is resisted by any outside force applied manually or mechanically. So the type of resistance that we can use is mechanically and manually against the muscle function. For example, if we want to improve the strength of biceps, then we will ask the patient to perform flexion of elbow against the resistance, which could be dumbbells or resistance applied by the therapist. So let us discuss the type of resistance. There are various type of resistance. Number one is mechanical resistance, under which we can use metal dumbbells or rubber dumbbells as a resistance or any free weights. Second type of resistance that we can use is theraband or theratube. This theraband or theratube has a property of elasticity and it can increase the resistance as we increase the range. For example, we are strengthening biceps using theraband. At the initial stage of the flexion of elbow, theraband poses less resistance against the movement. As you increase the flexion range, the theraband, because of the elasticity of the theraband, the resistance also starts to increase. So there is a gradual increase over the time for theraband, whereas for metal and rubber dumbbells, it is a fixed weight. Next type of mechanical resistance that can be used is weight calves. Fourth one is called as springs. So springs also can be used as a resistance which has a similar property as theraband. Other type of resistance that can be used is manual resistance, which will be applied by the therapist against the movement of the patient. And the third type of resistance is body weight of the patient or a subject against the gravity. So the best example can be the push-ups where the patient lifts the body against the gravity. Now let us discuss the determinants of the resistance exercises program, or the factors that influence the outcome of the resistance exercises or strengthening. What is the first factor that can influence the outcome? It is alignment of the segments of the body during exercises. So for example, if we want the body to move against the resistance, then it should be aligned in such a manner that the resistance has a maximum effect on the body which moves against the resistance. Second factor is stabilization. So by now we know stabilization plays a major role in our therapeutic exercises as well as any forms of examination. So stabilization of proximal or distal joints should be proper to prevent any trick movement or substitution. Third factor that can influence the outcome of the resistance exercises is called as intensity. Intensity is the amount of resistance or a weight imposed on the contracting muscle during each repetition or an exercise. So there can be a low intensity workout or a high intensity workout depending upon the amount of weight applied on the muscle. So the low intensity outcomes are used when low intensity exercises are used when the outcome desired is endurance. For improving the endurance of the muscle, we have to focus on the number of repetitions for the exercises rather than the amount of intensity that is to be used. So intensity can be low for improving the endurance of the muscle, whereas if our outcome is to improve the strength or the power of the muscle, then we have to use high intensity exercises, that is with more loads. Next factor is called as volume. Volume is the total number of repetitions and sets in an exercise session. Next is frequency. Frequency is the number of exercise sessions per day or per week. So it is simple to understand here. Volume and frequency. Volume means number of repetitions or sets in an exercise session, and frequency means how many times you perform the exercises per week or per day. Another factor that can alter the outcome is rest interval. So rest interval is the time allotted for the recovery between sets and sessions of the exercises. So this is very essential for having a proper outcome of the muscle after exercises. So rest interval can prevent any soreness or any further injury to the muscle. So the rest interval should be provided after every session of the strengthening program. So it can prevent any adverse effects of the exercises like fatigue or overuse injuries. Next factor is duration. The total time frame of the resistance training program is called as duration. And the last factor that can influence the outcome is velocity. It is the speed at which the muscle contracts against the resistance. So if the speed of exercises is too high, then maybe the outcome will be poor. Whereas if the speed of the exercise is too low, then again the outcome may be slow. So therefore the velocity should be optimal. Next, let us discuss about some of the benefits of strengthening exercises. So strengthening exercises can enhance muscle performance, restoration, improvement or maintenance of the muscle strength, power and endurance, so ultimately increasing the physical function of the individual. Strengthening exercises can increase strength of the connective tissue, tendons, ligaments, intermuscular connective tissue. It also has a role on increasing bone mineral density, or it can lessen the bone demineralization. Strengthening exercises can reduce the stress on joints during physical activity. So, for example, in case of osteoarthritis of knee, if your quadriceps and hamstring muscles are strong, it prevents the stress on the knee joint. Strengthening exercises can also reduce the risk of soft tissue injury during physical activity. If the muscles are strong enough, it won't be injured very easily. So, possible improvement in capacity to repair and heal damaged soft tissues are enhanced by strengthening exercises. Other benefits are possible improvement in balance, enhanced physical performance during daily living, occupational, and recreational activities, positive changes in body composition, that is, increase lean muscle mass or decrease body fat, and it can have a possible improvement in perception of disability and quality of life.